Hi everyone, happy Friday. Dr. Aimee Ostick here with Health and Healing Direct Primary Care.
And Dr. Brian Ostick, Amy's husband and emergency medicine physician.
And we're here in my office at Health and Healing in Woodland Hills. We will be talking about risk stratification today, about the COVID-19, about transmissibility. If you want more information, you can go to my website, www.healthandhealingdpc.com, and I put out a newsletter at the first of every month for my patients and my members, but I make it public. I actually did that starting through all this COVID because it's been a lot of relevant information. So June 1st, I'll have a new newsletter, so please go there. If you have any other questions about our practice and how we work, it's a membership basis. It's a great service for a lot of my patients. We do a lot of virtual medicine. Call us, talk to us, 818-600-2426.
DPC is really the future.
DPC has been able to be really flexible during this time, and it's been a real gift and a blessing. So we are going to talk about risk stratification. I've had a lot of conversations and questions from my patients about, as we start to reemerge and we start to reopen. LA County started to open up even more this week, with retail shops allowed to go back, religious services allowed to resume at certain capacities. Is it safe for me to go let my kids go to a certain school or a summer camp? Is it safe for us to go on a plane and see our grandparents?
Right.
So there's certainly a lot of questions and nerves and confusion about what's risky and what's not. And
let's get into
it. So first of all, there is no such thing as zero risk. Right? So when you do anything, even pre-COVID, you're out and about and you're exposing yourself to more people, you're running the risk of getting this virus.
Right.
So there's always going to be that risk. There's nothing that is zero, and there's nobody that can give you a number to an activity. There's no percentage per activity. There's just risk stratification, high, medium, and low, and that's how we're going to do it. Okay. So children, what we know now, we do know outside of the MIS-C scenario where you do have some children having the more severe illness, 99% of children do really well with this virus, transmit it much less likely to older adults than we thought, because we think that the school age population actually has this cross-reactivity with the antibodies from prior coronavirus, so they don't get very sick.
Okay.
And viral load is very much related to level of illness. So if they get very mild symptoms, they're not as contagious as somebody who has high fevers and coughing a lot and very sick.
So as we open up, maybe a small play date with a friend would be okay, understanding that there is a risk that goes along with that.
Right. So younger kids, play dates, much less risky than obviously a group of older people together. That's a riskier scenario. Outdoor versus indoor.
Outdoor seems to be much better in terms of avoiding transmission of the virus. When you're inside and in an enclosed space, you have a much higher likelihood of getting the virus.
Right. So outdoor activities, much less risky than indoor activities.
Get outside, hike, bike, run,
go to
surf,
the beach.
Go to the beach while maintaining your social distance.
Keeping that social distance and masking will really reduce your risk. So masking, what we know about it, it's not perfect, and the science and the literature behind masking is mixed at best. But every activity you do, when you do it behind a mask, you lower your risk of transmitting that anything really, and certainly the coronavirus, to your friend, to your neighbor, to your family.
Well, it's catching those respiratory droplets in the mask so that it doesn't spread to the person that's just a few feet away from you.
Right. So, and I said this before in previous videos, but that is how it's spread. What we know now is that it doesn't really behave any differently than a lot of other respiratory viruses. It's via large, big respiratory droplets. As soon as that virus leaves your body, it starts to denature and fall apart. It's not a happy day for that virus. So masking reduces that risk. Surfaces, it's really not transmitted that way. Much less, somebody would have to cough, immediately touch a door handle. Within 30 minutes, you would have to touch that same door handle and then touch your face for that transmission to happen. So masking, definitely. So that gets into surface area transmission. So renting a house, going into a neighbor's bathroom and using their bathroom, very low risk scenarios in terms of catching or giving the coronavirus.
Probably safe to do that. And for us personally, we're going to go on a vacation in August, and we're not going to be worried about going into that house.
No, I mean, they will hopefully, they will have had it cleaned, and there'll be several hours before the cleaners have left, or after the cleaners have left, or the family before us that was there. And again, we're swabbing these surfaces and we're finding viral RNA, but that does not mean that is an active virus. That just means it's chopped up virus. Mm-hmm. So very low risk. So I think that is something that, that we can feel comfortable doing. So what else about risk? I think that's about it.
Yeah, I mean, I think you have to understand that it's there, that there is a risk to any activity that we do, and that as we start to open back up, people are going to be back in contact with each other, and so those risks are just going to go up. You just have to understand what you're getting yourself into.
Yeah.
And be safe.
And be safe. And everybody has a different risk tolerance, and there's no judgment either way. I think you engage with your community and your neighbors and your family in a friendly, non-judgmental way, because you never know what people's backstory is.
Sure.
You don't know what kind of family they have or people they're in contact with. If they have vulnerable population at home, they have an older parent, they have a kid that's been sick. So you never know. So people are coming from this from very different perspectives. So we maintain our social distance along with a non-judgmental approach.
Be kind to each other. Have a little bit of grace during this time as we start to open back up. And wash your hands.
And yes, and don't be gross. Wash your hands.
Don't be gross.
Yeah.
Good advice, Dr. Ostick.
Thanks, guys. Dr. Aimee Ostick here, Health and Healing Direct Primary Care here in Woodland Hills, here for you guys. Have a wonderful summer. We'll see you next week.